Let's have a look at rheumatic fever. Rheumatic fever is a syndrome of many interrelated symptoms. They don't all directly relate to the heart, but we will see how this can seriously damage someone's heart. So we have inflammation of the central nervous system, the peripheral nervous system, all of the connective tissues such as tendons and skin, and the heart. And of course, that's how this ties into our lecture here. Rheumatic fever is most common in children ages 5 to 15, but we can see it in both younger children and older children and adults. Ultimately, this is all related to a strep throat infection. If you remember back to our communicable disease lecture, we were talking about how strep throat itself is not dangerous, but some of the complications that develop are dangerous. This is one of those complications. So a patient will get strep throat, the immune system gears up to fight off that strep throat infection, and then what happens is the immune system gets carried away and starts attacking healthy connective tissues within the body. So what we see with rheumatic fever is symptoms related to all of those connective tissues. Fever, of course, is just a nonspecific sign of inflammation in the body, but now let's look at the rest of those symptoms there. With polyarthritis, this is simply inflammation of many joints, poly meaning many, right? So it might be a knee and an elbow one day, and the next day maybe a hip and an ankle. So multiple joints at once, and it does bounce around from day to day. Carditis, of course, translated out, card meaning heart, itis, inflammation. This is inflammation of the heart, the muscle tissue, the lining on the inside of the heart, the vessels. Anything connected to the heart becomes inflamed. When the skin becomes inflamed, you develop both rash and then skip down to the bottom there, nodules under the skin. So the picture shows you the typical rash. It is referred to an annular rash. You can see there are little rings. Unlike a Lyme disease rash, however, you notice it's many rings connected to each other, whereas with a Lyme disease rash, it's that bullseye ring inside a ring. The nodules under the skin are simply small, hard lumps that might be a little tender, but aren't really painful in themselves. Finally, we have chorea. This is jerky, uncontrollable movements, and that's related to inflammation of the nerves and the nervous system. So with all these significant symptoms, what do we do for rheumatic fever? Well, because it is initially caused by a strep throat infection, it is customary to go ahead and treat with antibiotics just to make sure there are no strep bacteria remaining in the body. Those antibiotics will not have any effect on the symptoms, however. It's more to prevent further infection rather than treating current symptoms. Remember that the underlying cause of all of these problems is inflammation, so the first step is to treat inflammation. We might use non-steroidal anti-inflammatory drugs or even steroids. Remember that aspirin is a non-steroidal anti-inflammatory drug and is often used in cardiac situations, so we do even see aspirin even though this is a pediatric condition. If the chorea is bad enough that it requires treatment, we'll treat that with anticonvulsants. Of course, those are accompanied by things like dizziness and fatigue, so we do use them sparingly. Finally, we use long-term antibiotics to prevent any reoccurrence of this. Remember, this is in the United States, and especially in the United Kingdom, we might see different practice. However, here in the United States, we do see long-term antibiotics for about 5 to 10 years or until the patient is an adult. We have two options. We can do a daily oral medication, or we can do a monthly IM injection. If a patient is truly resistant to the monthly injection, we can use the oral medication, but the injection is actually preferred because then it allows for a built-in monthly follow-up with a healthcare provider to check on the cardiac status and to make sure the patient is truly keeping up with their preventative antibiotics. So ultimately, of course, the most dangerous part of rheumatic fever is the damage to the heart that occurs. So all of the inflammation inside the heart can lead to any of these permanent problems. Valve stenosis, valve regurgitation, which of course means the valve is not closing properly and allowing blood to flow backwards. The heart muscle itself can become damaged. And we can even see atrial fibrillation, which is an arrhythmia where the atria do not beat properly. Any of these can lead to that congestive heart failure that we were talking about, and we may not be able to fix the underlying problem, especially if it's actually the muscle itself that was damaged. With valve stenosis or valve regurgitation, we can use any of those valve replacement procedures we talked about earlier, but remember, those come with long-term follow-up.